So, hi there, I am Lucy Ferry. I am a Master's of Public Health student at Emory University in Atlanta, Georgia. And I am interning with the LGDA, and my sister actually has a CLA as well. So,
Oh, okay.
yes, so it's very, very nice to meet you. I'm very excited to hear more. Did have the opportunity to watch the video of the recent lecture you did, and it was so interesting. So, I'm super excited for you to share about that today. But maybe you could just start with introducing yourself and giving a little bit of a preview of your story.
Right. My name is Maurizio De Angelis. I am 48 years old. I live in London. I'm originally from Rome. I work as a medical illustrator for my own clients. I work for publications and also for the film industry. I was diagnosed when I was about between 3 and 7, initially with GLA, which is at the time was called lymphangiomatosis in Rome, and then through a quite complex medical journey, I managed to get a diagnosis, and which I finally had one. And then I had more problems, so I had to kind of stop the treatment for the GLA and think about something more serious. Um, yeah.
Okay, perfect. So, kind of, you touched on it a little bit, but can you maybe take us back to when your symptoms first appeared and kind of what do you remember about kind of your first experience realizing that maybe something wasn't right with your health?
I don't quite remember myself. I remember my mum getting worried, and probably the first doctor appointments, and because I was basically quite young, so I remember the hospital time, but I don't remember before then, basically. And the hospital time was quite challenging. I didn't understand what was going on, and I spent, I think, a couple of weeks in the hospital, and it was. I don't remember as a nice memory. Yeah, as a good memory. So, and then my mom had a personal problem at the time. She lost her brother, which was much younger than her, just a few months before my diagnosis. So probably it didn't help, obviously, even for her well-being, uh, because we actually faced the fact that we were confronting a quite rare disease. And so my uncle died for leukemia, so she thought it was leukemia as well. So it was a very intricate story, and also quite challenging for the whole family.
Yeah, it is so difficult as a child, I'm sure, to kind of get that news and not really understand what it means. But also with such a rare disease, sometimes maybe your doctor doesn't really know what it means to the full extent either.
Up to a certain point, because when the histology, they made an histology in 1984, and they said it was lymphangiomatosis. And the only reason I believe that happened because I had surgery in a very famous Italian hospital, which is called Bambin Gesù. And as I was saying, in the presentation, is owned by the Holy See, so it's a quite important hospital. So they have probably lots of cases. So they managed to get some children with GLA or GSD, but at the time it was called lymphangiomatosis, which is remarkable, to be honest. But at the same time, I don't think there was enough literature to understand about the disease.
Gotcha. And then I just wanted to ask, do you know what the diagnostic process was like at the time? Sounds like your doctors did have some exposure to, other cases that were maybe a little similar to yours. What did you go through in that?
Probably there was some other cases they had in the past before me, and in the histology they can see a proliferation of blood vessels and lymphatic vessels, and so I believe they just based their diagnosis on those aspects. Um, yeah, so this.
Gotcha. So then as you got older, when you kind of started to realize maybe your lymphangiomatosis had some other aspects that made it more complex than they originally thought. Could you maybe share a little bit about that and kind of how that came into play?
Right, so I had lymphangiomatosis. I had surgery twice, between 3 and 9, kind of, and I thought that was done. I had surgery, and I thought it was fixed. But at the same time, I started to feel a pain in the back of my skull, and I couldn't really relate that to lymphangiomatosis at all. And so when I was about 15, I started to see some doctors because I was experiencing a quite sharp pain and I couldn't understand why. And I investigated that for probably for a couple of years. Uh, I was at the time in Rome, but no one would understand the reason of the source of this pain. And so I left it there. Then when I was older, I think when I was about 30 or 32, I was in London already, and I started to feel that the shape of my skull was actually changing. So that was um, that was something that put me like, what is going on here? It's not normal that the head is changing shape. And then in London, I started this hospital journey. Sorry, I don't want to jump any questions. So basically, to reply to your question, I started to suspect my condition was more complex. I would say when I was about 30, not yet when I was about 15 years old. When I was about 30, I started to say, something going on.
Gotcha. And you were experiencing, 15, 17 years or whatever it was of that sharp pain in the back of your head, sounds like.
Yeah.
So what challenges did you face trying to navigate the healthcare system, especially as your case became more complex with this pain?
It was extremely challenging, to be honest, because um, I mean, the healthcare system in the UK I mean, it works, absolutely, it works very well, but there's not really the resources to investigate, to spend time, to ask one doctor to do like a personal investigation. So, but the main problems that I experienced, that the doctors just didn't know regarding this condition. So it was unusual for them to hear that my head was changing shape. And I said in the presentation as well, sometimes they were like, "Are you sure? I mean, is it not just your impression?" And it wasn't. And so I think I spent 3 years moving from one hospital to another. They're quite large, big hospitals in London, about, I think there are 5 or 6, and I believed I went to all of them, jumping from one specialist to another. It was very tough, very frustrating. It's difficult sometimes to get clear answers, or even to speak to someone on the phone is really tough. So, I mean, again, it's a public service, and obviously it doesn't work perfectly. Yeah. So, but I can't complain.
Gotcha. So what was it like experiencing those symptoms and then kind of having the doctors maybe dismiss you a little and say, maybe this is just how you're feeling. This maybe
Hmm.
not be something that's, medically abnormal.
I mean, they generally it was like as you said now, and but most of the time they couldn't really understand, and you had like 10 minutes or 15 minutes appointment, and they give you another appointment in 6 months, but nothing happens that 6 months really. No one's going to you know dig deeper at all. So yeah, so that's why I started my 3D medical illustration investigation. After that point, one doctor took it seriously. I managed to somehow to arrive to land to a place where there was a specialist that he heard about lymphangiomatosis before in his life, and he was almost retiring.
Gotcha. Okay, so can you maybe paint that kind of picture? You were told that your imaging was normal, and then you kind of took your profession and your passion for medical illustrating, and you used that to kind of explore what was wrong.
Yeah, I mean, to be fair, the first CT scan I had, they in the report they said that it was cranial erosions, erosions on the skull. But then when I was sent to have an MRI, that report came back without highlighting any problems. But the problem that I faced at that point was that if that exam said everything's fine here, there's no reason to keep investigating. So because I knew that something was going on, I basically said, no, wait a minute, we can't stop it now, so I have to take stuff in my hands. So I did, and sorry, I just want to come back to your question. So basically, I did what a radiologist should do in a way. I mean, I took all of my exams, I compared them all, and I highlighted this is the problem. I mean, this is the erosions getting larger or bigger. This is an activity. And I started to highlight all of these differences. And so when I went to the new appointment, I brought with me the iPad, the printout, just to show that that's you know that's real. This is not my imagination. And so in that sense, being a medical illustrator absolutely helped me a lot.
Makes sense, yeah. So can you maybe walk us through how you use the data to build the 3D models and illustrations of your skull and kind of that bone erosion that the doctors noticed?
So basically, when you have a CT scan or an MRI, you are placed on a bed, and there are a number of images that are taken of your body. So there's a software where you can extract all of these images, and then you convert this sequence of images into a 3D model. It's a quite technical thing, but you can basically convert a sequence into a 3D model. I mean, I wouldn't describe this in more details, but so once you have a 3D model of your skull or of your body, you can work on it. You can create animations, you can create illustrations, and this is basically what I did. I took my 3D models, I and then I created a number of images, a number of illustrations.
Gotcha. That's so cool. Very awesome that you could take what you're passionate about and kind of make it work for you. Um,
Yeah.
so how did the I know you said that they kind of started to take it a little more seriously once you brought the iPad and everything, but can you touch a little more on how healthcare professionals responded when you showed them your visual reconstructions you made?
They were very surprised that a patient could do that. First of all, I received a few comments like, "I never had a patient who did this," and I mean, medical illustrators are not very many, so we're just a bunch of artists that work in this field. And yeah, first of all, they were very surprised, and but it also really helped. It really helped, especially with the doctor. I managed to get treatment through that doctor, and he was quite sure that it was GLA, which is a sort of an umbrella for other conditions or lymphangiomatosis, whatever. Um, but yeah, so that yeah, to come back to your question is this.
Gotcha. Okay, so moving right along, you kind of touched on some issues you had with your femur replacement surgery and those kinds of things. Could you maybe share that story and kind of how that developed and what the decision to undergo that replacement surgery looked like?
Um, so basically, I was in hospital to look at my skull condition, and one of the specialists decided to have a full body scan, which I never had before. And So basically, in the full body scan, they spotted something in my femur, and they said the your head is sort of normal, like static, not increases or at least not major changes. But there is something in your femur that has to be looked at. Because I was in a hospital wing, I had to be sent to another hospital in London, which is the orthopedic hospital. And then I went through a number of other scans and biopsies and exams. And the problem with bone tumor, especially in the cartilage area, that it's not possible for modern oncology to differentiate if it's a benign tumor or if it's a malignant tumor. So either tumor, that was pretty sure, but they didn't know if it was cancer or if it was just a benign tumor. But even if it was a benign tumor, because it was inside the femur, so the femur is like a tube, so it's empty inside. So the mass was inside the femur. So even if it was a benign tumor, it would have grown. So my femur would break in the end. Um, so I had to have surgery anyway. And I was a bit unfortunate in that respect because I had a tumor in a very specific spot. They couldn't save the proximal femur, which is the top part of the femur. So they had to resect the whole proximal part, which was about 22 centimeters. It's a major part of the femur. I mean, I'm tall, but still, I mean, it's a considerate amount of femur that had to be removed. And yeah, so they removed the femur, they implant these prostheses, and so I got rid of the cancer. It was cancer in the end, and got rid of it. And but yeah, I lost some. I have a walking impairment. I've suffered from chronic pain. So, I mean, I'm still alive, but yeah, I paid quite a bit. I think my head condition was more than enough, but so the fever was like, ah,
Yeah,
gosh, yeah,
yeah, definitely. And so that was a really long recovery and there were some
very
complications
long,
and stuff. So how has that shaped your daily life, since then?
massively, massively. I mean, up to the femur cancer, my major concern was the head. When the femur came into the scene, I basically forgot about my head condition. Basically, this surgery was impacted me like in a way that's difficult to explain. Um, some people can say, I mean, it's just a leg, but because of the joint, the joint is basically the motor of our body. Even if we sit down, if we need to turn, we use the joint, the hips. So it took me a long time. I think maybe 3, 4 years to recover to a level of uh, I don't know. I wouldn't say normal life because my days were dictated by pain. So if it wasn't for the chronic pain, I would have recovered earlier. But feeling pain is just it's basically killing you. Yeah.
Gotcha. So how do you manage these physical and emotional aspects of living with this chronic pain and the mobility challenges that have come with this surgery?
So in the initial 3, 4 years after surgery, I was in a very bad state, physically and emotionally. Um, you know, feeling pain is awful, on a daily basis, on a constant basis is awful. You lose your temper, you have some rage on a stupid things, and then I managed to get a treatment for chronic pain, which I take a tablet a day. simple as this, and it basically reduced my pain for at least 40%, which, it's a big amount. I still deal with pain, and but I can control myself in a way. I know that I can't go into town and walk for the entire afternoon. I know that I can't go for a walk or for a hike, or we used to go all over the place in the world. For the last 7 years, we actually didn't, so it's not fun. It's not fun at all.
Yeah, that makes a lot of sense. It's definitely,
Yeah.
I know I've had a lot less pain than you in my life, and it's so exhausting to just,
Hmm.
go through anything like that. Um, so I wanted to ask, obviously this has been a really hard experience, but I think something that's really cool about you is that you've taken the medical illustrator passion that you have and you've used it to not only transform your story, but you've wanted to help and advocate for yourself and others. So I
Mhm.
wanted to see if you could maybe chat about that, and how this dual identity as both a patient and a medical illustrator has influenced the way that you advocate for people in the community.
Yeah, I helped out two guys in the community, and basically they sent me all day CDs and CT scans and MRI, and I basically did the same for them, and I advised them to, at the next appointment, to point out certain things with a printout, so like a patient can be also someone that can tell there must be something going on in these pictures. To be honest, I'm not entirely sure how far they went um, with their appointments, but I'm sure we helped them out
Yeah,
a little bit at least. Yeah,
I'm sure you gave them tools that they didn't have before that could help them advocate for better care. So,
yeah, yeah, for sure.
yes. So you mentioned also helping other rare disease patients visualize their imaging. Can you tell us a little bit more about that? Looking at different diseases?
Well, I helped these two guys. They had one had Gorham-Stout disease, and I the guy has this disease affecting his spine, and it's a quite large area of the spine. And so again, I mean, I just made a few illustrations. I wrote down some notes for them to ask to their doctors. And the other guy didn't have GSD; he had GLA in his skull, as myself. And again, I did the same for this guy. Yeah,
Gotcha. So I would personally definitely say that that your illustrations definitely bridge that communication gap between the patients and providers, especially when you're dealing with providers maybe in a system that don't have as much knowledge about your disease or something like that. Uh,
yeah, yeah. To be honest, also radiologists. I mean, a radiologist should see in front of them that that is not like a normal bone, so eh, even with the community, it's great that we are putting together so many documentations and so many cases. So I mean, obviously, in that sense, we can spread, the knowledge of this
yeah,
disease.
definitely. And I have really enjoyed getting to learn about what LGDA is doing in that with, consensus of care and those kinds of things to just make sure that we're spreading the word of what these GLAs are and how, doctors should be treating them. Um,
Sure.
so looking back on your journey, what do you think made the biggest difference in getting you the care that you needed?
Um, I would say perseverance. So I think, that you insist. I mean, I don't want to say fighting the healthcare system, but it takes some energy to do that. To do that, so the biggest difference is the fact that I insisted, and yeah, I'm not normally aggressive or anything at all, but I've been a little bit stronger than usual to achieve, at least what I wanted to achieve. There was just basically some attention, to be honest. So, like a professional could take my case seriously. So sometimes I'm not sure in the States, but sometimes in the UK you have to push a little bit more than usual. But it's understandable in a way, because if you have a very rare condition, um, it's difficult for the professionals to understand the condition for you. So it makes sense to push more, you know.
Yes, definitely. Moving on to the last question, I wanted to ask, what message would you most want to share with others living with rare or misunderstood conditions?
What message? It might sound silly, but be patient and uh, and strong. I think that's the I don't know. I mean, again, it sounds silly because I understand that when someone is in pain, obviously you are all over the place emotionally, but it's important that you are there as solid as you can be, because if you don't take it seriously, probably no one would do it for you. Obviously, for adult patients, I mean, so if you don't do it for yourself, it's difficult that you're going to sort it out. So um, yeah, so I would say that, yeah, I understand it's not easy, because I remember there's so many breakdowns on so many levels. So and it's tough because it also there's I never suffer from mental health or that in never in my past, to be honest. But that those very dark moments where it's very difficult to go back to a normal life, a normal feelings, and so I understand that people that are more sensitive than me, or probably get less strong than me, or whatever. But it's important to stay focused, so as much as possible. So that I would say that.
Gotcha. Well, thank you so much for your time. This has been incredible. I really love your story. I think it's so cool how you used your passion to kind of advocate for yourself. All right. Well, it was great chatting with you. I hope you have a lovely evening. Sorry this is a little later for you.
No problem at all. No problem at all. Thanks very much for the call.
Yeah, of course. All right. Well, have a great evening.
And you. Bye bye. Thank you.
Bye.
Bye bye.